you are talking with some form of apathy and bitterness, maybe because of what you...
Yeah, because, you know, one of the reasons why I'm a little concerned, ignorance is bliss. If I were not aware of the right thing that is happening in other parts of the world, I will not really be bothered, because no man is wiser than the information before him. But when I see my country going so below expectation, knowing what is happening in other parts of the world, I feel sad. Yes.
Okay, you know, we're talking about Nigeria as a whole. Let's zero into Edo State now. I know recently you had to do something. If we say health is cheap, we have heard about health insurance. And I know you have done something in that regard in Edo State.
Yes.
How useful has that been vis-a-vis the healthcare delivery in Edo State?
Yeah, that is coming up. I think one of the lasting legacy the current Edo State government will leave is that health insurance, if allowed to thrive. Because I mean, the governor, I don't know from Adam, I'm not a politician, I'm an academician, I don't even know the difference between the parties. Because if you ask me which are the parties, I sometimes can't even remember which one. I confuse them. So I'm completely outside the domain of politics. But I'm an academician and I want things to be done properly. And I think one of the things he did right was the fact that he called me to help when he saw the potential, because there was a summit on how to remodel healthcare in Edo State, where I was invited to give a keynote address. And that keynote address went into so many areas, you know, of how healthcare can be improved. He read the materials and spotted. So he probably on that basis decided that, well, I've identified this guy who can help us. So I was just called to come and put that health insurance in place.
So do we see a lot more Edo people now receiving free healthcare, so to say, or subsidized healthcare?
No, exactly what I'm saying. There is, when I say mindset of politicians being our undoing, the mindset of the average Nigerian is even worse. The greatest thing that could salvage us in this country is to change the people's mindset. For example, the average Nigerian wants government to take care of his health. He wants free health, just like he wants free education. Nothing can be given to you free. So the government itself, because they want the people's votes, deceive them and say that I will go to give you free health when they know it's not possible. Because for health insurance, for health care financing, there are 3 models which the world has put together. We have the Canadian and British model of National Health Service. The National Health Service is driven by contribution from tax. I worked in British National Health Service. Even me as a doctor, I was paying so much tax. There were 2 taxes. There was the normal tax and the national contribution, national social insurance contribution. And that contribution was paid directly to the NHIS to finance health. So everybody who works in UK pay tax. And so they are able to generate enough money to do that health. The same thing with Canada. Every person who works paid heavy tax. And that tax is paid into the health system, and they are able to give you free health. Nothing is free. You are paying for it. People are paying tax, you know. So that is one model. That model cannot work here because, number one, the gross domestic product in Nigeria, as at now, is about 400 billion. And then the tax of the people, the tax collected, has not yet reached 4% of the GDP. Whereas the average tax collected in UK and all the rest is between 35 to 50% of
they
GDP.
are very compliant there.
So people don't pay tax and they want free health. Who is going to pay for it? So that cannot work here. The other model that has been put in place is the model of contributory health insurance. In the contributory health insurance, people contribute money, and that money is put together and to take care of those who are ill. You contribute money whether you are ill or not. It's like an insurance. You contribute against the time you will be ill. So, and then that contribution is calculated on the basis of the actuarial calculation, your risk. Your risk will determine how much you will pay. So at the end of the day, everybody contributes. And then when the volume is high enough, you can get enough reserve to take care of anybody who falls ill from that money contributed. So that is another model. Which health insurance, that is the one that is practicable in this country. The problem we have here in Nigeria is the fact that the mindset of the people is dependent. The average Nigerian's growth has not gone beyond 6-year-olds. That is the logic whereby you feel you should be fed. You feel you should be taken care of. You feel government should take care of your health. That is a wrong mindset. Very, very wrong mindset.
Total dependent on government facility and
total dependent on government to take care of you when you have not contributed anything to it. That is a wrong mindset. Now, people should change that mindset to the fact that I need to contribute to my health. What government needs to do is to organize the people. For example, according to World Bank estimates about Nigeria, the average Nigeria spend about $112 every year on health. On health. About $112. That is the average. I mean, after the total average. Now, out of this $112, what government spend is about $8.5.
Wow.
Government, even if you put the international partners on it. And then by the time you put the private sector who spend for workers, other faith-based organizations and the rest, the total is not up to 25%, about 25. So 78 to $80 out of that is out of pocket expenses. When you are ill, you go and sell your property, you borrow money, you get yourself treated. And this money is inefficiently spent. So if government can galvanize people to contribute enough money, you can get treated without paying a kobo.
We're actually in a classroom. You already said that you're an academician and it's mentoring on television. It's still the Magnate. Prof, sir.
Yes.
Let's take you back home now.
To Edo State, yes.
You have contributed, you have added value to medical practice abroad. I don't want to enumerate the countries.
Yes.
Nationally.
Yes.
You're still a consultant with World Health Organization.
Yes.
Now let's go back to roots.
Yes.
You come from Edo State. Edo North, to be precise.
Yes.
And we have looked at the whole of Edo, how you added value.
Yes.
Research reveals that as much as you and a few people, I'm doing modest by saying few, a lot of medical doctors or medical practitioners from Edo, your contribution is not being complemented with appropriate medical facilities. Is that correct?
Yes. Looking at it from that angle, there are two components of medical practice that are complementary. The first one is facilities and personnel.
Expertise.
Expertise as well as facilities.
Yes.
The second one is finance, funding, medical funding. Now, the two must complement each other. If you have expertise without the funds, it will soon collapse. If you have big facility there without funds, to maintain it, it will soon collapse. So the two have to go together. For example, there are government teaching hospitals, federal government and all the rest in Edo Central and Edo South. There is no federal government tertiary health center in the Edo North. So you don't have such a very fantastic
if it is only because of your influence, an internationally acclaimed professor of medicine to put there, what's the advocacy? What's the clamor? I mean,
the thing is this. Putting tertiary health center in a place is just the beginning. It's not the total solution. Sustainability is very important.
Yes.
And for sustainability, you must have adequate funds to put there. The problem we have had with health is that government has not been realistic to know the more realistic sustainability factor for our health care. In order to sustain this, you must have adequate flow of funds. So for now, government 100% fund health care, and teaching hospital people pay token fee to get treated. But you find out that there are a lot of facilities in private practice too, where people pay economic to get treated. So in order to maintain this, there must be a way of organizing funding in such a way that you can sustain this equipment. For example, if there is a lot of funds by way of health insurance in Edo State, for example, which we put in place, if that works and there is enough quantum of funds, what would happen is that it's not government, but even private individual can organize themselves and put in a tertiary center, a tertiary hospital in that area.
Okay, Prof, you are talking of a tertiary hospital. The little I know is that there exists one, which is the Auchi Central Hospital. What is the state now?
Auchi General Hospital is not a tertiary hospital.
Okay.
It is a secondary health center facility. But it's not actually functioning now
optimally
as a secondary health facility. And of course, the reason why it is not functioning as a secondary health facility optimally has to do with funding and organization. Okay. It can function properly if there is a proper management structure, proper funding, and proper organization. It is unrealistic to expect government without contributory health insurance to fund secondary and tertiary care from his meager budget. Because healthcare is very expensive. Put it that an average Nigerian spends $112 every year. That translates to about 50,000 naira, isn't it? For health. For 4 million people, how much is that?
It's a lot of money.
That is a lot of money. In fact, the total quantum of fund is more than the total government budget.
Wow.
So if you expect government to fund everything optimally, it's not possible. So people need to contribute. And if the contributory health insurance, that's why I said it's going to be a lasting legacy for Edo State. Because if it works and people are contributing and there's quantum of fund and it's managed properly, so this Auchi General Hospital can be built up.
Okay, that's why you are there, a professor of medicine. I think you should galvanize your colleagues, your indigents and everything to make sure that, because really, if you want to refer, we know that IRWA is there, UBTH is there, and talking about Edo generally because we have to talk about health.
Yes.
Now, in rounding up, sir, we are in the period of pandemic, coronavirus, COVID-19. What is the relevance of, we started this conversation with a neurological practice, as a neurologist. What's the relevance of managing a COVID-19 patient? Is a neurologist relevant there?
A neurologist is relevant when it started. people thought COVID-19 was just a respiratory problem. People used to go and buy ventilators, they go to ICU, they give them oxygen, and so on and so forth. But as time went on, they discovered that most of the people who die of COVID-19 may not actually those who require respirator. A lot of people die of other diseases. And then we started noticing neurological conditions. For example, let me start with the worst. Some people will have stroke, and a lot of people die of stroke in COVID. Why do they have stroke? Because COVID as a virus, there are three possible things that can happen to that virus. Number one, when the virus enters you, your body resistance can withstand it and eventually overcome it, and it goes away without causing any symptoms. Number two, your body can combat the virus. That is sort of your immunological reaction can attack the virus, and you have severe inflammatory response to that. That is what's a cytokine storm. And that is what makes the lungs inflamed, and then you start breathless, and so on and so forth. And then the cytokine storm itself was also found to affect the brain. Some people are found unconscious, and when they check the brain, they see that they have a brain inflammation.
Wow.
The inflammation of the brain as a result of the cytokine storm, and some have encephalitis as a result of that. There are others, peripheral neuropathy, like they get paralyzed, suddenly paralyzed as a result of the inflammation of the COVID. Then, so that is discovered and has to be treated. Then there is also the question about the other reactions. Not the people who have very low resistance and cannot attack the virus very well. The virus multiply and create problems. The greatest problem the virus creates is clots, blood clots. It causes widespread clotting of blood all over the body.
Wow.
So you find out that
where you come in.
Yes, the widespread clotting of blood causes the patients to have a stroke. A blood clot in the brain it will suddenly become paralyzed, and then that is a stroke. And you see, there are young people, suddenly they become paralyzed, even without any evidence before that they had COVID. And then the blood clot can be disseminated, so you may even have multiple organ failure. So people who die of COVID may not necessarily be distressed, or they may not as those who survive, but they will simply have multiple organ failure because of widespread blood clots in the body. That is why neurologists are relevant, because when this thing come on, you know that you have a serious crisis.
Yes,
the patient may not even be breathless. He may certainly not be, he may just have confusion, loss of consciousness, and then some will be paralyzed. And so when you have a multiple blood clot causes stroke, you can be sure that there are blood clots in the kidney.
Wow.
And then you have multiple organ failure, and then the patient dies. So neurologists are very relevant in stroke. And the people who are doing this are those who have lost their immunity, potential immunity. If you have diabetes, for example, your immunity is weak. And most people who have serious diabetes can't survive COVID because their immunity is weak and they can't attack the condition as much as, or those who have other conditions like cancer and other diseases.
Well, as much as you have painted this scenario, it does exist. A lot of denial out there.
Yes.
And I'm sure as you come in here now, a lot of people are just even working like business as usual.
Yes.
No face masks, no social distancing, no nothing like because they are in a state of denial. What's your final counsel for us, sir?
Well, we must realize that COVID is real. You know, I have had some people in interviews say, oh, this COVID is 419. That is not correct. It is real. It's a virus. It's an RNA virus, and it spreads very fast. It spreads through the air. So to move around, you have to put on a mask. And then COVID, apart from in the air, it drops on the floor. The virus can survive on the floor, on this thing for a long time. So when you are moving around, even if you are wearing a mask, you might have touched it with your hands. So you have to constantly wash your hands. And then before you touch your face, you should have washed your hands. And so you maintain that hygiene of constant hand washing, social distancing, and wearing a mask constantly. If you wear a mask, if you have COVID, you can't transmit it. If you don't have COVID, you cannot, you may protect yourself partially against against COVID. But wearing a mask is not the only solution. You must also add to that constant washing your hands and also social distancing as much as possible. So people must realize that COVID has come to stay, and it cannot just go away so soon. Maybe next year, when there is a vaccine for it and people are now taking the vaccine, then we can start thinking about the fact that it will go away.
It does seem that all you medical practitioners have made up your mind or have come to a consensus that this COVID has come to stay, because we have been hearing that quite a bit, you know, on this program. It has come to stay, and you just have to, you know, realize that fact and do the needful.
Yes, we just have to realize that fact. The fact is that when you wear a mask, you wear it sensibly, with science behind you. If you are alone in a room, you don't need to wear a mask, because there's nobody around to start infecting you. As a doctor now, if a patient comes to me and is so far away from me, he can talk to me. He can remove the mask and talk to me, and I can remove the mask. As we are talking now, we are distant enough not to transmit it to each other. But if you are moving around and you are likely to go close to someone, you must put on a mask, and that person must put on a mask.
Professor M.A. Danesi, consultant neurologist, being in medical practice internationally, nationally, and adding value to even his home state, Edo State, from South Ibie to be precise. Thank you very much, sir, for coming on the Magnate.
You are welcome, and thank you for
That has been mentoring on television. We have really, truly been enlightened. He says he's an academician, and we have been in the classroom. He's tutored us. That has been the Magnate today. Join us same time next week when we shall continue with this sensitization of coronavirus, COVID-19. We need to do the needful and protect ourselves so that we can reduce the scourge. The number of infections, we are just so alarmed with the high numbers being recorded every day. Join us same time next week for another edition of The Magnate. Until then, bye for now.